This is not a rural or urban issue or rich or poor issue. There are people that I see that are homeless with addiction issues. I also see people with $500,000 homes with addiction issues. This is an issue that affects everybody in the community. My name is Shawn Arrand. I'm a paramedic and vulnerable patient navigator with Essex Windsor EMS. I work for the County of Essex. Our catchment area is all of the County of Essex, including Peely Island. We provide emergency medical services to that area. Essex Windsor EMS has played an active role in the opioid crisis. We respond to all emergency medical calls for service for overdoses. We have been responding to ever increasing numbers of calls for overdoses over the last couple of years, especially over the last, I would say, 5 years. We have been increasing numbers of overdose calls that we're responding to, and we provide emergency medical assistance to those experiencing an overdose. When I first started as a paramedic 20 years ago, an overdose call would be very rare. We do maybe once a month, you do an overdose call on a shift. Now it's ever increasing where you'd be doing an overdose call per shift. So we're doing something that's every day, which used to be something that was a rare call. Those calls that we do get are becoming more serious in nature, especially with the addition of carfentanil and other stronger forms of opioids. We're seeing more overdoses, more serious overdoses, and more Narcan is required to use it. Even increasing numbers of Narcan is required to reverse the overdose is that we see. A typical call is started when we receive a 911 call for service in our dispatch center. That call is then dispatched out to a unit. The unit will arrive on scene. They typically find an unconscious patient with a decreased respiratory rate or not breathing at all. At that point, they will insert an airway into the patient's mouth and begin rescue breathing with a BVM. After that's done, a base set of vitals will be taken, and after that, Narcan or naloxone will be administered to the patient to reverse the opioid overdose. At that point, within about 3 or 5 minutes, the patient will wake up and begin breathing on their own, but that's not the end of the story for us, because there is the chance of a rebound overdose where the Narcan will wear off before the opioid in the system wears off. At that point, the patient needs to be transported to the hospital for monitoring for rebound overdose at that time. Now, unfortunately, a lot of the patients who do overdose don't want to necessarily go to the hospital, and they refuse service. So at that point, we have to explain the risks associated with that there could be a rebound overdose in the situation, and that they should come to the hospital, but it's always up to the patient whether they want to. It's impacting frontline workers in EMS as we are responding to more and more overdose calls over the course of our time. It can wear down the crew after repeated overdose calls during the course of the day. We do feel a lot of empathy for our patients who are suffering from addiction, and we would love to delve deeper into their issues and try to help solve those issues. But unfortunately, within the ambulance, we don't have time on a typical call to be able to do that. There are repeated overdoses that are going on with the same patients that we're trying to get into help. There are people that are losing their family members, they're losing mom and dad, they're losing their children, and there's more and increased homelessness associated with opioid use disorder, and as well as ever increasing overdoses with the most powerful opioids that are coming onto the market, including carfentanil. I think it's all our responsibility to address the opioid crisis. I think there needs to be a whole of government response. I think more resources need to be added to areas like the Traditional Stability Center, the Salvation Army, the Mission, and Family Services to allow them to begin to start battling this crisis. I think the community is doing well in getting naloxone kits out to those people who are vulnerable patients in need. We're doing a great job of getting the kits out to where it's needed. Over the last couple of years, we've noticed more and more in EMS that the people that we are responding to for overdoses are already receiving naloxone before our arrival. They're already up and about before we get there. That is a big change for when we had to administer it ourselves, and it's having a positive impact on overdose deaths for sure in the community. I think the community could do better in addressing the opioid crisis with having more resources that are needed, more treatment beds, as well as more social workers and addictions counselors that can go out into the field and see these people in real time as the overdose is happening, to give assertive outreach, to give harm reduction, to give addictions counseling to those people in real time, as closest to real time as possible. This is something that's new that we're doing at Essex Windsor EMS with the Mental Health and Addictions Response Team. We will be pairing a paramedic with a social worker who will be responding to overdose calls in the future as well as now. And we are going to be giving those assertive outreach as well as counseling right at the time of the overdose to hopefully get the person into treatment programs and harm reduction strategies before a repeat overdose occurs. For far too long, people have looked at having an addiction as a moral failure. It is not a moral failure. A lot of the people who have addictions have trauma in their lives which are unaddressed. This is not their fault, and we need education campaigns to destigmatize having an addiction, like Label Me Person, that is going on right now. We need these desperately out in the community to try to get rid of the stigma so that more people will be coming in for addictions counseling as well as treatment. We want to get as many people as we can in there, and the stigma right now regarding it is holding some people back from getting that treatment.